The four major classes of antiemetics in veterinary medicine are antihistamines, 5-HT3 or serotonin antagonists, substance P/neurokinin-1 antagonists, and dopamine antagonists. What these antiemetics have in common is they block the action of key neurotransmitters that communicate nausea to the brain. These neurotransmitters are serotonin, histamine, acetylcholine, neurokinin, and dopamine. When choosing antiemetics, it's important to consider the cause of the nausea as well as the features of each drug. Here are some examples of how different situations can trigger different nausea-activating neurotransmitters. Gut irritation via ingestion of toxins or other stimuli such as GI viruses can trigger a surge of serotonin. Serotonin then activates the vomiting center. A good antiemetic for this is ondansetron because it blocks serotonin. Things that activate the vestibular system, like viruses or motion, can trigger the release of histamine and acetylcholine. This is why meclizine is often used for motion sickness. It has both antihistamine effects and anticholinergic effects. Direct stimulation of the chemoreceptor trigger zone by things like opioids or chemotherapy drugs will activate the vomiting center. The chemoreceptor trigger zone, or the CRTZ, has a lot of different receptors and can respond to a variety of antiemetics. Chemotherapy drugs and general anesthesia can trigger neurokinin release from nerve fibers in the gut. Meropitant is a neurokinin antagonist and is often utilized as a pre-med for surgery to prevent nausea or to prevent nausea from chemotherapy. Gut irritation or gut distension can trigger dopamine release, which then triggers the brain. Metoclopramide is a D2 or dopamine antagonist in the brain and can help stop vomiting triggered by dopamine. Next, I'll review a few key points for each drug. Meclizine, as we know, is a good treatment for conditions like vertigo, which affects the vestibular system. It would not be a good drug for GI-specific nausea. Meclizine is available over the counter and is an oral drug. Meropitant is probably the most widely used antiemetic in veterinary medicine. It is available in both oral and injectable forms. As an injectable drug, it does sting, so injecting the product cold can help reduce the sting. Ondansetron and meropitant are considered pretty equivalent to prevent vomiting. However, certain chemotherapy drugs cause more serotonin release, while others cause more neurokinin release. It's also important to note that these drugs are caution drugs for MDR1 dogs. These dogs have a mutation that allows certain drugs to build up to dangerous levels in the brain. And finally, for metoclopramide, it's most commonly used for its promotility effects on the GI tract, so it's really helpful for ileus. The other notable thing about metoclopramide is that cats don't have dopamine receptors in the brain, so it's not considered to be a useful antiemetic in cats.